Okay, we're about 3 minutes past the hour, and I want to be mindful of everyone's time. But if anyone comes, they can just join along. But again, thank you all so much for joining our November office hours. These webinars are meant to be small, hands-on, interactive. So throughout, the presentation, if you have any questions, drop them in the chat, raise your hand. We're happy to, stop and go over anything. Or of course, you can leave them towards the end. But just to start, I want to introduce myself and the members of our team that are on today. I'm Samantha Breslin. I am the project coordinator for the dashboard, and we're joined by Peggy Shea, who was our research analyst, and she will be speaking later. And then Stella Yee will be joining us as well from CSAW, the Center for the Study of Asian American Health. And so just before we begin, we'd love to hear a little bit about who's joining us today. Please drop your name, the city or the organization you're from, as well as if you're new to the dashboard or you're a bit more seasoned into the chat. And just as a run of show, we're going to start with a brief intro and then move into a demo of the dashboard and its features. And then we'll, after that, we will explore our newest feature, why we're all here, on the dashboard's demographic maps and tables, as well as we'll share how they can be useful in local work on the ground to improve health and equity for all communities, but particularly for diverse communities. So with that, we can start. Sorry. So at the dashboard, our goal is to help cities across the US leverage the power of data to improve the health and well-being of everyone in their community. And we created the dashboard in 2018 with the ultimate purpose of helping mayors and city leaders improve the health of their citizens. But prior to our tool, the only data available for cities was available at the city level or the county level or the state level, not the city or the neighborhood level. And so, sorry, I thought I muted everyone. Please mute yourself. I will just make sure. Yep. Mute all. Sorry about that. So we changed that in 2018 when we launched with over 35 measures of health, the drivers of health, and the drivers of health equity for 750 US cities. And when we launched in 2018, we only had 500 cities, but this year we were lucky and able to expand to over 750 US cities. The dashboard, it was developed by our team here at NYU Langone at the School of Medicine in the Department of Population Health, but in close collaboration with the NYU Wagner School, the National Resource Network, as well as the National League of Cities and ICMA. And in developing the tool, we worked very closely, and it was very important for us to work with city partners, with organizations on the ground on our measure selection, our website design, implementation, and user testing to create this easy to use one-stop shop to create healthier and more equitable communities. We're an academic institution. We're not on the ground, as they say. So it was really, it was one of our main priorities to get those real world city perspectives when designing the tool. So how can you use the dashboard? Any user who comes to our website can use this tool. It's very flexible and can be used in a many number of ways. So for example, the data can be used to compare health gaps across neighborhoods in a city, to compare your city to cities in other regions or with similar demographics, as well as, you can use it to set priorities and better understand, where to target your resources and get the biggest bang for your buck. And on the right here, we can see just an example of life expectancy in Columbus, Ohio, where, these three neighborhoods that we've highlighted are less than a mile away, but residents living in those neighborhoods can expect to have very different outcomes. Measure selection. We applied very rigorous criteria in selecting the measures for the dashboard. I won't go into all of these right now, but all of our data and all of our metrics come from national data sets, which allows us to you can compare apples to apples. High school completion in Santa Rosa, California, is measured the same as high school completion in New York City. All of our data and all of our metrics we wanted them to reflect public health priorities. Cities needed to care about what we were providing them. And on top of that, they needed to be able to do something about it. So that was another, really important thing for us to think about when we were, choosing the measures and the data that we did. And all of our data is also balanced over 5 overarching domains. So we have health outcomes, clinical care, physical environment, health behaviors, and social and economic factors. And you can see all of our metrics listed here. There's over 35 of them. There's a lot to see, and there's a lot of information on this slide. So I'll break it down just a little bit. But all of the measures that you see here in navy are available at the city level, whereas the measures labeled in yellow are available at both the city and the neighborhood or census tract level. And so with that, I will get my computer working to get the website up. And so we can everyone see the website? Great. So this is the City Health Dashboard website. It's completely free and accessible to anyone with an internet connection. All you have to do is go to cityhealthdashboard.com and you'll get to the site. So you can enter your city in this box. I'm going to start with Santa Rosa, California. And this box will come up. It has all of the same metrics that I just showed you in that slide, but I do want to draw your attention to a few new features that we have. So we have these new labels or we also have them for updated that can tell you, oh, this metric is new, or we just updated this metric with new data. So it's just another way for us to connect with our users and make sure that they have all of the information they need to use the site effectively. So if you want to explore, COVID risk in your city, feel free to, click into that metric. But let's just say you don't really know what you want to explore yet. So we have this overview option, which gives users a more high-level overview of, how their city is doing across all of our metrics. You could see here we have these new demographic tables and maps. I'm not going to go into those yet. Peggy is going to give those overview. But just so you know, the demographic maps and tables can be accessed for everyone from their cities, from each city's city overview page, as you see here. So just moving down, you can see this at a glance look of all of the city's performance across all of the metrics. And if we get to the one I want, I'm going to click into right now high school completion. And so here you can see a thumbnail of this metric, some information about it, as well as the map. And then I want to click into that today. That's what I want to explore. Sorry, there it is. See metric detail allows you to click into the metric detail page, which has, again, the same information that was just in that thumbnail, but expanded in a lot more information. So across all of the dashboard cities and metrics, everything looks basically the same. We have this navigation bar at the top, which leads you through all of the dashboard's features. I will go through these in order, but when you're exploring the dashboard for yourself, you can obviously click around and mix and match how you go through the site. So this page shows how Santa Rosa is doing for high school completion in this case, but again, for any metric. And you could see here, this scale bar, we have a variety of different signposts to help users understand their data, understand what's going on. And this scale bar is one of the main ones. Across the dashboard's metrics, lighter colors indicate better outcomes, whereas darker colors indicate poorer outcomes. So in this case, for high school completion, higher values are better. And you could see that by this check mark in a circle, which signals to you that higher is in the direction of better outcomes. But for example, a metric like diabetes or obesity, lower numbers are better. This gold bar here is the city level value or the census tract level value. And this navy triangle is the dashboard city average. And I just want to draw your attention to this green check mark, which is present when the city or the neighborhood level value is better than the dashboard city average. So in this case, high school completion in Santa Rosa, 85.7% of Santa Rosa's residents have a high school diploma or equivalent, but that's compared to 87.1% across the dashboard city average. So they do not have a green check mark in this case. Moving down, we have what my favorite part of the dashboard is the city level maps. And so these maps make it really easy for users to kind of see any patterns in neighborhoods at a glance. It's clear here, again, better outcomes are lighter colors, darker colors are poorer outcomes. And, you can see a real pattern in the west side of Santa Rosa where people have, or might not have high school completion rates. And you can also click in. Hovering shows more information about that census tract or neighborhood, and you can click into each of the metrics to see more information, and those show up on the side. And moving forward, the dashboard for around 1/3 of our metrics, we provide demographic information or data disaggregated by race and ethnicity. And this data is different from what we provide in the demographic maps and tables that we will go into later today. But having the data available broken down like this is, it helps users see the differences and the disparities or potential disparities between different groups. And you can see here that, across the 5 ethnic groups that we provide data for, there's very different outcomes across those groups. We also allow users to compare cities. Obviously, every city will have its own roadmap towards better health, but it is really helpful to see, how are our peers doing? What programs or policies are they passing that maybe we could pass in our community? And so we have a couple ways to do that. You could enter your city here if I'll just use Anchorage. You could enter it there, and it'll bring up Anchorage's data right here. But let's just say maybe you don't know what city you want to compare yourself to, or if you're a city like Santa Rosa who gets compared to Sacramento maybe, and you don't like that comparison doesn't really make sense to you, we have this filter feature to help you make comparisons based on population size or population demographics, things like that might be more meaningful to the work that you're doing. And I also want to bring your attention to the city type filter feature. And this summer, we created a report that looked at health outcomes data across small and mid-sized cities in the country. And we created this typology to group like cities together. And so that can be found here in this city type feature. And you can learn more about that by clicking this question mark. But if we click by working towns, which is the typology or the city type that Santa Rosa belongs to, you can see a whole list of cities that are similar to Santa Rosa in demographics, and a variety of other variables. So, a city like Lubbock, Texas is a peer city, and that will be shown here. Comparing metrics. One of, the tenets of the social determinants of health is that, all of these things, where you live, where you work, where you play, are all connected. Health is so much more than, what happens with your doctor. And it's really important to look at metrics, not in a vacuum, but to see how they relate to other things, to other issues, other challenges. And we provide that functionality with this metric comparison feature. So if we're looking at high school completion, maybe we want to also see how that compares to an insurance rate. rates in the city. So if you just click that and then you click uninsured, we allow users to do these comparisons in two different ways. The first is our metric comparison map. Again, I just want to stress that you could see the information for the two metrics here. High school completion is our primary metric. The data for that will appear in blue polygons, whereas the comparison metric, uninsured in this case, will have red or pink circles. And again, for both of these metrics, better outcomes, lighter colors, darker colors, poorer outcomes. So if we scroll down, we can see the uninsurance data kind of mapped over the high school completion data. And again, those same patterns that we saw earlier, whereas lower high school completion in the west side of the city is accompanied by residents who might have lower access to health insurance. And again, this just provides a more nuanced, comprehensive look of health, of outcomes, of well-being, and can help us, target our resources or craft our programs that might help both issues at once. And then just a few more things I want to follow, or I want to go over in the demo. And this one is our take action section. We built this out around a year and a half ago. The take action section is where you go to take data to action, as the name implies. We heard a lot from users when we first launched the tool, like, okay, you've shown me all of this great data. I know what I want to do in my city. I know what issue I want to solve, but now what? How do I get the ball rolling? How do I, craft that policy or design that program or implement, that policy? And so we have the take action section, which has over 300, evidence-backed resources across 5 different categories. Find policies and programs is pretty straightforward. In this case, it has programs or policies specific for high school completion. We also have resources to help you find partners. And we know, obviously collaborating, breaking down silos is how we get things done today. But who are those people? Who can we bring to the table? And that's what you can find in Find Partners. Explore strategies, is helpful for advocacy, communicating with the public, all of these things that help us get the work done. Find funding. There's never enough funding. There's never enough money to get this stuff to fulfill our goals. But we have a couple ways for users to understand, where is the money available? What tools do we have at our disposal to find that funding and to actually apply for that funding? And then finally, we have Measure Impact, which helps users understand how they can leverage their own data to make sure that their programs are functioning the way that they intended. And then finally, I want to just bring your attention to our data access page. All of our data is available and free. Free for download in two different modes. We have CSV and text files, which can be accessed here, but we also have an API if you are a more advanced data user. And I just want to mention that so the dashboard has multi-year data. I just realized that I did not bring that up in the beginning. We have multi-year data available for 29 of our metrics. So a large portion of our metrics, you can find data as far back as 2013. And so all of that data will be available in the API, but the data that is available on the site through CSV files will be the most recent year available. And with that, I will go back to the slides and I will pass it over to Peggy, who will take us through the demographic maps and tables.
Thanks, Sammy. Before we look at the demographic maps and tables on the live site, a brief introduction to why they're important and what they are. The importance behind demographic maps is that there's really a need where demographic information is often only available in broad categories such as Asian, and this puts all Asian subgroups into one large group. And this type of aggregation can often mask important variation across subgroups. However, with population groups growing across the US, especially for Asian and Hispanic subgroups, it's increasingly more important to get an understanding of where various demographic groups reside. And cities and stakeholders can use this tool to identify neighborhoods that would benefit from resources and interventions. These maps could be especially helpful for leaders who are in small and mid-sized cities and community organizations who may lack data capacity or analytic skills compared to big cities like New York City, where New York City has greater capacity and resources. And this is especially true for demographic maps like these because demographic data can often be very difficult to work with. And so the dashboard decided to fill this gap by providing city and census tract level demographic information on numerous racial and ethnic subgroups and age groups. And this granular data will be able to help guide city leaders and stakeholders to improve health in local areas. And so let's talk about what these maps actually are. They're neighborhood level maps using census tract level data for all dashboard cities. For these maps, you can filter by either age or race, ethnicity, and foreign-born data. We also have demographic tables that display the city level demographic information. And also just before moving forward, we really wanted to extend a huge thank you to our partners at the NYU Center for the Study of Asian American Health for their expert guidance in developing these tables and maps. And you're going to hear from someone from Seesaw later on. And these images here are just a quick snapshot of what the maps and filters look like on the site. On the left, you'll see a city filter for age 65 plus. On the right is a city filter for the Japanese subgroup. And later we're going to do a quick demo and explore these maps further. So just to provide a bit more information about the data, we use 2018 American Community Survey 5-year estimates. We have data on specific racial ethnic subgroups for Asian, Hispanic, and Native Hawaiian or other Pacific Islander. And these subgroups are based on data availability as well as expert consultation. And then you'll see here this key. So a lot of the subgroup data that we present is at a level of granularity that's not commonly seen due to small estimates or unstable data. And since we wanted to provide information for as many subgroups as possible, we've marked unstable estimates with a small blue symbol next to it, which you can see on the screen here. This small blue symbol flags to users that these estimates should be interpreted with caution. And if you're interested in learning more about these estimates, you would be able to click on the hyperlink Learn More on the site. And so now let's turn it over to looking at this live site. So again, we're going to use Santa Rosa, California as the example. And as Sammy mentioned earlier, the demographic maps and tables reside on the city overview page. The city overview page now has 3 tabs. There's metrics overview, which Sammy showed, and the new ones are the city level demographic tables are on the demographics overview tab, and then we'll go into the maps next. So as you can see on the demographics overview tab, we have tables that display the percent of city population of each race and ethnicity subgroup. You can see more disaggregated data for Asian, Native Hawaiian, or other Pacific Islander and Hispanic populations by clicking on the plus sign to expand the table. The Asian group specifically is further categorized by these intermediate groups, as you see here, East, South, and Southeast Asian, and this is for improved usability. You can click on the plus sign next to them again to view the specific subgroups. And so similarly, you can click on the plus sign to expand the NOPI group as well as the Hispanic group to see their respective subgroups. And just as previously mentioned on the slide, you will see a blue symbol next to unstable estimates, and you'll see the key on this page, which describes how these estimates may be interpreted with caution. You can click on the Learn More hyperlink. And so now moving on to the demographic maps. These are found on the third tab, Demographics by Census Tract. And so for these maps, you're able to select one of these two filters, either age or race, ethnicity, and percent foreign-born. Due to the way we collected our data, you're not able to select both filters at once. And so it's age or race, ethnicity. So let's start with an example for age. We can look at age 65 plus. And so if you scroll down, you'll see these maps look similar to maps that are seen elsewhere on our site, such as the metric detail page that Sammy showed earlier. You're able to hover over the tracks for more information or click on any of the tracks that you're interested in, and they'll appear in the highlighted track section. Also on the right, you'll see a little scale bar and also some values. In this case, it will show that overall 16.1% of Santa Rosa residents are aged 65 and over. However, when you get down to the census tract level, you'll be able to see that there's two easternmost neighborhoods that have the highest population of people aged 65 and up. And if you click on them, you'll be able to see that around 70% of an individual tract is over 65. So it's really interesting to see how there are all these values at such a granular level. And for even more detailed information, you're able to click on the table view to be able to see values and their respective error margins, as you can see here. And so now let's look at a different example using race ethnicity. So we can go ahead and select Asian. And so when you filter by race ethnicity and you select a group that has additional subgroups, you'll see additional filters pop up to guide you. And in this case, we could click on East Asian next, and then we'll look at the Japanese subgroup. And so as you can see on the map here, these maps really show how the Japanese population varies from neighborhood to neighborhood. And while there might not be a clear pattern, there are several Japanese residents in the northern part of this city. And so that you can also compare and contrast, so we can compare this to another Asian subgroup. So we go back up to the filters and we select Southeast Asian and then Laotian. You'll be able to see that, the map changes a lot. It looks really different from the subgroup we were just looking at before. In this case, you can see that with this darker colors symbolizing there's more Laotian residents in the southern part of the city. And so clearly there can be immense variation across these different subgroups, and these maps really help highlight those differences. And then we're also really excited to have foreign-born data on these maps as well. So, for example, we looked at the Hispanic foreign-born. Again, we'll see the map changes, and we can see that the western part of Santa Rosa has higher populations of Hispanic foreign-born. And lastly, as I mentioned earlier, we have NOPI subgroups as well. So just to do a quick example of that, you can select NOPI, and then on the additional filter, you'll be able to select Ndu Samoan. And so again, you can see where there are a few neighborhoods with higher Samoan populations in Santa Rosa. So I hope that these examples give you all an idea of how the demographic maps and tables can be used. And with that, I'd like to invite Dr. Stella Yee to speak with us on the importance of disaggregated data, especially for Asian American populations. Dr. Stella Yee is an assistant professor in the Department of Population Health at NYU Grossman School of Medicine. She leads the Applied Research and Evaluation Unit in the Section for Health Equity within the department. Dr. Yee is a cardiovascular epidemiologist and her research is grounded in the application of rigorous methods, including mixed methods, community partner system science, and implementation science, to address issues and inform policymaking and program implementation in the real world and community settings to improve health equity. Her specific content area expertise is on policy and community-partnered programs for urban immigrant populations, including Asian Americans, nutrition and lifestyle behaviors, and cardiometabolic disease. So thank you, Dr. Stelly, for joining us today. I'm going to turn it over to you.
Hey, thanks, Sammy and Peggy. Hi, everyone. It's one of our other team members is also on the line, Matthew Chin. So we're really excited to provide some information for you and context, but also, to engage with you with the Q&A after this. So let me take a moment to share my slides. Okay, can you see this? Okay, great. All right, so I just have a quick, 10-minute presentation about the importance of disaggregated data for Asian American communities. To set the context, the Asian American population grew faster than any other race group in the United States between 2000 and 2010, and Asian Americans make up about 5.6% of the US population. On this next slide, I have a list of 20 different countries. If you were to list as an individual, if you were to list one of these countries as your country of origin, upon arriving to this country, you would be categorized as being Asian American. So that certainly helps us to appreciate the diversity of groups that are included under that monolithic category. And certainly this is not an exhaustive list. But, to Peggy's point, and as we all know, particularly here in New York City, the monolithic racial ethnic categories and the problem of aggregated data is really an issue across all of the racial ethnic groups, not just for Asian Americans. So certainly for Latinos here in New York City, we have a vast array of different types of Black people, people who are from the Caribbean, people who are from Africa, people who are, Black Americans. And even in the white population, there's a sizable proportion that are foreign-born whites, and they have a very different health profile than US-born whites. And so it's very important to understand the aggregation of data, not just for Asian Americans, but really for all racial ethnic groups. On the right-hand side of the slide are the 20 largest US Asian origin groups. There are about 17.3 million as of 2010. I'm really interested and excited to see the new 2020 data as it starts to come out. But the 6 largest groups are Chinese, Filipino, Asian Indian, Vietnamese, Korean, and Japanese. And I highlight these 6 largest groups because, number one, they make up about 86 to 87% of all Asian Americans. But secondly, because if you were to see data disaggregated by specific Asian subgroup, you may see one of these 6 groups. The other thing that's interesting to point out about the Asian American experience is the fact that they are not geographically distributed evenly across the United States. So this is a map that shows the distribution of the largest Asian groups by state in 2010. And you can see that, oops, sorry about that. You can see that within different states there are different distributions of Asian Americans. So for example, in California, the largest Asian group is Filipino, or in New York State, the largest group is Chinese, or in Texas, the largest Asian group is Asian Indian. And so when you talk about a national sample of Asian Americans, it's really difficult to you have to really think about what that really means, because if people are sampling from specific states or specific geographies, and they say that they have an Asian American sample, it really might actually be composed of many different Asian subgroups. To understand how this interplay of subgroup and geography plays out in real time, you don't really have to look much farther than the Hispanic experience with the 2020 presidential election. So we observed, for example, that Cuban Americans were supporting Trump in Florida and Mexican Americans were supporting Biden in Arizona, and really that we can't be defining people within their monolithic categories anymore. So we need to be accounting for ethnic heritage, geography, and culture within all racial ethnic groups, including Asian Americans. I just wanted to provide one example of the importance of disaggregated data just from a socio-demographic perspective. So one of the reasons that disaggregated data is very important for Asian Americans is because of facts like this. If you look at Asian Americans as a monolithic category, education and income levels, and also many health indicators actually look more favorable amongst Asian Americans than they do in the US total population. So for example, 49% of US Asians have a bachelor's degree or more versus 28% of the US total. US Asians have a median household income of $66,000 compared to $49,800 in US adults overall. However, if you actually disaggregate this data by those 6 largest subgroups that I pointed out to you earlier, you can see that there are actually, it's a totally different picture that emerges in terms of these 2 different socioeconomic indicators. So for example, US Asian Indians, a very high percentage of them have a bachelor's degree or more compared to the Vietnamese, which is about 26%. And similarly, Asian Indians have a very high median annual household income, but Koreans have a much lower income. So this is just a very simple example of why disaggregated data is important to look at and consider for different subgroups. Just sort of a plug in general for why data is important. So data analyses are an important starting point to planning, resource allocation, and policy making. So to sort of illustrate this, I put together this like non-exhaustive and crude representation of a cascade of events that starts with a primary data source, such as the City Health Dashboard. So, you know, you have something like this. This might be followed by an analysis, a publication, a compilation of knowledge, which could lead to a systematic review. And then this then leads to further study through funded grants, evidence-based practice and policy, and potentially complex modeling, such as artificial intelligence. The problem is that if you don't include Asian Americans in the primary data source to begin with, or those subgroups or the subgroups data, then what happens is that it essentially stymies the representativeness of the entire pipeline of future research and practice. And this systematic lack of data will perpetuate the continued mismatch between the health research literature and the growing diversity of the United States. So I wanted to just do a little pivot just because everyone is thinking about COVID, and I wanted to provide some additional data, which isn't really publicly available yet, but illustrates the different experiences that Asian American subgroups have been having with regards to COVID-19. So first of all, I think what's interesting is that COVID-19 is actually disproportionately affects all people of color, not including Asian Americans, Native Hawaiians, and Pacific Islanders, but you will not often see this dialogue communicated within the media or within the scientific literature or within sort of a general understanding of COVID-related disparities. But there is data to demonstrate that Asian Americans do have a disproportionate, have been disproportionately affected by COVID, as have other racial ethnic minority groups. And this resource from the Marshall Project actually does a nice job of explaining this. The toll on Asian Americans has received far less attention, perhaps in part because the numbers who have died, about 14,000, have been far lower than several other groups. Still, the 35% increase in Asian American deaths is the second highest behind Hispanic Americans. So that's number one. I have another slide sort of aggregated across those monolithic categories that shows the same thing, that Black, Hispanic, and Asian patients had significantly higher rates of hospitalization and death compared to their white counterparts. And this was an analysis that was released in, I think, August by the Kaiser Family Foundation. But I wanted to share just a couple slides that have data on COVID-19 disaggregated for Asian subgroups. So generally, this is a little bit out of order, but generally speaking, you know, all Asian American groups are more likely to be residing in multi-generational housing. So number one. Secondly, there are specific Asian American, Native Hawaiian, and Pacific Islander groups that have an elevated burden of diabetes or prediabetes, which we know is a leading risk factor for COVID sequelae and poor outcomes. And those are Filipinos, South Asians, Pacific Islanders, Koreans, and Chinese. And then we also know that there are specific Asian subgroups that are disproportionately represented within the essential workforce, particularly healthcare and the food industry. And again, those are actually very similar groups, the Filipino nurses, South Asians, Pacific Islanders who work in the meat packing plants all across the Midwest, and the Chinese. But these are some additional data points that we have been gathering on specific subgroups. So all Asian Americans actually have been facing economic challenges. There's been a slower recovery of Asian American owned versus other minority owned businesses. They have some of the highest unemployment rates, going from like the lowest unemployment rate to the near highest with COVID. For East Asians and Southeast Asians, many of you have probably seen a lot of the news reports about xenophobia and racist attacks. For Chinese specifically, we have actually done an analysis looking at Health and Hospitals Corporation data, which is the largest and oldest public hospital system in the United States. It's located in New York City. And what we did was we improved the classification of race ethnicity within the Health and Hospitals Corporation data, and then we actually disaggregated by Asian subgroup. And what we found was that the Chinese patients actually had the highest mortality rates out of all of the racial ethnic groups, pointing to this idea that they're not really presenting at the hospital unless they are really severely ill. And we also know that the Chinese groups have very low testing rates. And this pattern is also reflected within data in San Francisco. Amongst South Asians, we similarly found in the Health and Hospitals Corporation data that South Asians have a very high infection rate as well as hospitalization rates on par with the other racial ethnic minority groups. In other work that we've been doing with Pascual Rumo, who's a faculty member within this department, he's found that Asian Indians and Vietnamese are also additionally facing issues with food insecurity in light of COVID. So just to sort of illustrate the fact that those monolithic categories, like, they don't paint the full picture. And when we actually dig down and we look specifically at different groups, the strategies that you would use to actually reach these groups would be very different if you had all of this subgroup data. So I just wanted to end and close with a couple of use cases that were compiled by our team, Landon and Matthew Chin in particular, in terms of potential use cases for others who are interested in this subgroups data on the City Health Dashboard. So for example, basic demographic percentages of a city can be used for reports or grant applications, right? Which is just data that wasn't available before, so it's super awesome. You can highlight specific Asian American groups that are within any given city and where they are located. This was an idea that Matt had proposed, providing information for areas to target for outreach, whether it's through door-to-door knocking or events, or identifying other community partners, as Sammy mentioned earlier. It's helpful if an organization is considering expansion to another site. Maybe they want to check out where there is a geographic density of a specific Asian subgroup. And it's especially good for viewing the non-Chinese subgroups that typically get washed out of Asian demographic maps because of the large Chinese population. And then the last example use case could be providing justification for what social determinants of health or what health outcomes to focus on. Generally speaking, when we've worked with community-based organizations, they have a pretty good idea of those health outcomes already, but the data can really just help to solidify that picture and then help them to advocate for funding as well. So just a quick acknowledgement slide, which Peggy already gave us a very nice shout out, but that's all I had, and I'm happy to take any questions.
Thank you for that fantastic presentation, Stella. And as she said, we're opening it up for questions. Feel free to type it in the chat or unmute your mic and ask away.
Hi, this is Kristen from the Evanston Health Department in Evanston, Illinois, and really, really loving your tool. Thank you so much for developing this. This is really helpful information for us to get at the city level. One thing I'm wondering about is, love your interactive maps. Is it possible to print those? I don't really see an option for like including graphics of your maps in our reports? Is there a way to embed that either like electronically or in a PDF form?
Kristen, thank you for that question. This is one we get a lot and a challenge that we're actively trying to figure out. It's as if we paid you to ask that question. So right now, we're not able, like you can print, obviously from the dashboard, but it's kind of a funky looking print screen kind of situation. So what we suggest and what we even use ourselves right now until we get that functionality is to take screenshots. It's not so high tech. It's not ideal, but it works. And that's what we're doing at the moment. Happy to talk with you. If you ever have any questions about, getting a high res image from the dashboard, like I will put my my email in the chat, but screenshots right now are your best option. And uploading those to like PowerPoint or Canva or Adobe, that is the best thing you can do right now.
Okay, and as long as we, obviously cite the dashboard, it's okay with you if we include screenshots?
Yes, of course.
Okay,
Please do cite us. And we have on our data access page a suggested citation there. But yes, everything, this is an accessible website. We want people, sharing this data. So yes, just as long as you cite us, feel free to screenshot away.
Thank you so much.
Okay, there's a couple questions in the chat. Anthony, can you explain, maybe Peggy knows this, you're asking about relative ACE. I am not familiar with that acronym. So would you mind just explaining your question for the group? Are you still
I
here?
see that Anthony said relative ACEs among subgroups or adverse childhood experiences. Okay, thank you. Yeah, so we currently don't have adverse childhood experiences as one of the metrics on the site. But of course, we're always looking into new metrics and new data sources. We do have rigorous criteria for the types of metrics and data that we put on the site. And so, yeah, if you know of any to point us in that direction, we would love to hear it. Sammy, do you have anything you'd like to add?
No, that pretty much sums it up. We're always looking for new data sets and new things to add to the site that are meaningful to cities. And this is one that we have heard about. Now that the acronym wasn't coming to me at the moment. But as Peggy said, the data we're limited by data sets that provide the data for all the at the city level and the neighborhood level, but also just in what is available. So this is on our radar, but we do not have that right now. We also have a question that just came in. Are your data sets only pulling from population sets greater than 50K? So right now, our population threshold to be included on the dashboard is cities with a population of 50K or higher. We have a couple exceptions to that rule. But those are on a kind of like a grant basis. So we're always interested in partnering with groups, partnering with cities on how we can expand that and include more cities. But right now, it's only the 750 largest US cities or those with a population of 50K. But if you have any ideas on how we can collaborate and work to expand that threshold, please reach out to us. We have another question, actually a great question for right now. How will the undercount of the 2020 census affect your tool? Something also that we're thinking a lot about, but I will pass that one over to Peggy as she is on our data team. So I don't want to talk out of turn on that one.
No, that's a fantastic question. Our team has really been grappling with what the changes of the 2020 census will bring. For this demographic maps and table tool in particular, we haven't talked yet about how we're or if we're planning to update the data, but some of our metrics on our site do use ACS, Data American Community Survey from the US Census, and so our data team is definitely currently thinking through like the changes in the 2020 census, how to incorporate that, and updating the data on our site. The undercount question specifically, I think it's really great, and our team would definitely be excited to discuss that more. And so, yeah, that answers the question.
And then we have one more question that I'm seeing right now. How are you disseminating this data to policymakers? Another great question. This is something that we think about a lot. We have this great tool, this data, it's all amazing, but how do we get it into the hands of the policymakers, the change makers, the community organizations? And that is why our partnerships with groups like the National Resource Network, the National League of Cities, or ICMA, which are organizations that work directly with city managers or directly with mayors and policymakers to just introduce us to those groups. We're also always, going to presenting on webinars at conferences, trying to get that access. And thankfully, we have great partners across a lot of different cities and states that do get us in the door. But we do not have right now a formal process to disseminate the tool directly to policymakers, except just being free and available and accessible and having those and leveraging our networks.
Yeah, I can add to that also. So because this has been developed in partnership with our center actually is focused on New York City and the New York metropolitan area, but we do maintain partnerships at the national level with over 70 community-based organizations, as well as a key policy partner who is the Asian Pacific Islander American Health Forum. And then within the partnership with the Health Forum, we also work together with 6 different coalitions that serve Asian American, Native Hawaiian, and Pacific Islander communities. So we have disseminated this tool to all those different partners. In fact, some of our partners who are on our National Advisory Council were involved in the presentation of the data and some of the decision making on the back end in terms of the best ways to present subgroups. So adding on to the Asian American specific, Asian American, Native Hawaiian, and Pacific Islander specific dissemination activities that we are having.
Thank you, Stella. Are there ways to link a city's data to their own webpage? This is another great question, and one that is becoming more and more popular. We're seeing this with cities where, we have partnerships, and even in cities where we don't have partnerships, where a city will have an open data portal and they will include the dashboard data there, or they will just link to us. Manchester, New Hampshire, actually, on their their COVID task force webpage, as part of the health department in Manchester, include the dashboard as well as our COVID data. And that was completely unprompted. We didn't really have a relationship with Manchester prior to that, and they just used and cited our data on their website and just linked back to us. We also, from each city's overview page, we include links to the city website or the city government website. Sorry, I'm just reading for questions. I think I've got every question in the chat. But again, feel free to share your questions over the mic as well.
I was just noticing Anthony's comment about how that we use census data. I just wanted to highlight that we do have an air pollution metric, PM2.5, that does use EPA data. We also do have a walkability metric that uses data from Walk Score, and so we're definitely really excited about always looking at more data sets and adding it. So thank you for that.
I have a question about the logistics of downloading your data into a CSV file. It looks like when I've tried to download it, it looks like it will take me to that page you showed where I can download all the city information within one state. Is it possible just to download a CSV file of only a specific metric for only a city, or do I have to go through like the whole state level?
So, Kristen, you're right. The data that we provide on the website, just for everybody, is either the full dashboard city data set or all of the cities in one state. But if you email us, I can drop the email in the chat. We'd be happy to cut a more specific data file for anyone who emails us.
Thank you.
Am I not muted? Can you guys hear me?
Yes, we can.
Just since that was great comment about the air pollution, and since I brought up the walkability index, it does seem like we're at an inflection point with COVID, and my thinking is all bets are off. But it's not just that; it's politics, it's the economic downturn, it's a pandemic unlike what we've seen in 100 years. It's so many factors, and so really we have to be mindful of how a lot of these things are both, as they say, challenges and opportunities. And so I think that the data that you're providing and the data that, like I referenced, the EPA data kind of gets there. And like I spend, how much time on webinars anymore trying to develop the skills to either map it or provide it to my community partners. And so first of all, I want to applaud this, but see how we can take it to even the next level because of, the whole idea of health and all policies and, health impact assessments and social impact assessments and, the like. So how do we continue on? Just the idea of, the fact maybe what was brought up, the air quality, there are so many interconnections with some of these factors that we talk about. When you provide a big list of environmental and social and economic and healthcare, the very basic gestalt, how they all kind of fit together within the context of the most vulnerable. And so that what are the mechanisms? If we were to really put our thinking caps on and look at multivariate modeling of some of these things, we can start to put the right leverage and pressure on. Since I teach medical students, I'm sitting there going, you guys are living at the most exciting time for a transformative change in the way we view not sick care, but wellness and well-being.
It's a great question, Anthony, and one that's an amazing one to end on. I think you're right. We are at an inflection point, and also, as Stella mentioned, in her presentation, until this data is out there and on the ground, we're constrained by what we can do. But fortunately, we have groups like Seesaw, like what we're doing here at the dashboard, to get these tools, to get this information into the hands of community organizers, the hands of policymakers in cities across the country. And if there's one thing, like you just mentioned, that is could be a positive of the COVID pandemic, is that people are thinking about these problems. People are thinking about health in the way that we've been talking about health for decades now, and that all of these issues, all of these challenges are so related. They're not siloed. Housing is a health issue, as we're seeing obviously right now with COVID. And so I think that is, I hope, is going to put, the foot on the gas for people outside of the health sector to recognize and really get the needle moving on a lot of these interrelated, interconnected challenges.
Thank you. Beam me up, Scotty.
And I just wanted to highlight specifically, since we mentioned COVID, we do have the COVID Local Risk Index as one of the metrics on our dashboard that we're really excited about. And the index is made up of a lot of different components. So there's health outcomes, there's the social vulnerability index. They're all components of this index. And so just similar to what you're saying, there's so many different factors that really play into it. And so this is one of our attempts of creating a metric that is hopefully useful for communities and researchers to look at COVID risk.
And just noting on the COVID Local Risk Index, since Kristen, you were asking about downloading the data earlier, that is a separate data set right now because we are looking at possible updates to it. So if you want that, just email us and we're happy to send it, but we just want to be able to track who we're sending it to, but really happy to send that out.
Okay, I'm just looking at the time. We are at 3:03, so I do want to be mindful of people's schedules. So thank you all so much for joining us for this month's office hours. It really was such a great discussion, and we're so happy to be partnering with Seesaw and to get all of this great information out into the public, out into the world. And it's been quite a ride to get it out, but it's there. And so we can't wait to see how people use it in their own work. I do want to mention that we will not have an office hours next month. We will pick back up in 2021, which is kind of crazy to even say. But again, thank you all so much, and have a great rest of your day and a great holiday next week. Thank you.
Thank you.